201. 21. Just updating my my tracker. I'm sure there's a more efficient way to do this. But so Amazon, what's the latest price? 20210 BRK. This is what you guys should do. Have a list of stocks that you track. I don't really use this Excel file. It's on my phone. I have is it an app? Yeah, the Yahoo Finance app, and I just star my favorite stocks. And every day I look at it, especially when the market's open, to see how those stocks are doing. But we kind of have in our head what we want to buy and sell. Google's down. Jeez. I'm just updating what's Lyft's latest price. 1453. It's up 10%. Meta 682. Microsoft. I'm glad I bought a lot of Microsoft last year. It's doing well. The good thing of the stock market is you don't have to think. Just pick a winner. Generally, because if you have 100 stocks, like 100 random tickers, and you just pick 5, chances are most of those companies will not do well. Most stocks don't do well. It's the big stocks that tend to do well and drag the market up. And the stocks that do not do well, they go out of business and they kind of fall off the map. So they're not even part of the calculation anymore. It's called the term survivorship bias. That's why, myself included, that's why if you look at someone's portfolio, it doesn't really tell you the whole picture. Unless you have access to all their trades over time, which is kind of hard. I did a video on Oscar Health, which is kind of an interesting stock. I'll show you survivorship bias, why you can't even look at people's portfolio, even your favorite traders. Because say, for instance, I have like Goog, and then on buy-in current. So say I bought 10,000 for Google. Survivorship bias. So here's an example of survivorship bias. And say it's worth like $42,000. Okay, gain percent. Okay, that's my gain. And say I bought I don't know, I might have bought Google, I don't know. Could have been 5 years ago. Let's say I bought Tesla. Um, I mean, you should really look at it on like an annual basis. Um, what's a stock that went out of that kind of went to nothing? That was a really good stock at one point. Maybe AT&T or CBS. Did those go down a lot at one point? Intel's a good one. Intel kind of say a lot of these buys were a while ago. Okay. So just giving you an example of survivorship bias, like how it could make your portfolio look really, really good. Okay. Okay. So say this is my portfolio. It's pretty simple, right? I might have bought these stocks over time, but say this is what it looks like as of today. Um, let me let's see. let me let me put a new tab because I don't want to screw up this tab. We'll talk about Oscar in a minute. Survivorship bias. Okay. Say this is like on 12/31. This is my let's pick it. Say this is on May 31st at the end of last month. So my buy-in for these stocks is 155K. I'm currently at 322K. So I had a gain of 167K. So it's 108% return on investment. Everything is up except my Intel. I lost 75% on Intel. So it looks like a good portfolio, right? So if I just sell Intel, um, and let's say I buy, it doesn't matter, QQQ. So Intel is currently the value of my Intel is $19,000. So say I buy 19,000 of QQQ. Oh, say on June 1st I buy 19,000 of QQQ. So that means I got rid of the Intel, and my QQQ is it's still $19,000 because it's only been one day since I've held it. What's today's date? Today's the 21st. So let's just pretend. So we can do yesterday was the 20th. So on 6/19, Thursday, this is my portfolio. And then the following day on Friday, Today's 21st. Okay, this is my portfolio. So it's the same value. My current portfolio, well, my assets, my stock is worth $322,000 in both portfolios, because really nothing changed in terms of my value. The only thing I did was I sold my Intel, so that kind of fell off. It fell out of my portfolio, and I bought QQQ. So on Thursday, if you looked at my portfolio, like if I showed it to you, you would have said, "Oh, you're a good trader. You're up 108%, and you have $322,000 of stock as of on the 19th." And the day after, all I did was I sold my Intel and I bought QQQ. So this is how it would look on my brokerage account. It would never show Intel. Intel would be gone from the view, and it would appear that I have a buy-in for QQQ at 19, and it's currently 19 because it's only been one day. I mean, it might have changed a few $100, but I mean, let's just pretend it's 19,200. Let's say it went up 1% on Friday. About $200. But you see the drastic difference in terms of gain and percentages, because that loss of $56,000 is kind of wiped out. But it doesn't really matter the gain or loss, because I do get a tax write-off when I do my taxes because I sold it. But it's a huge difference in terms of percentages. The same value, the same exact value, but percentages is a big difference. So if I was like looking for investors, right? Say I had my own like what's it called? Investment firm. It's a small boutique investment firm, and I'm looking for more investors. Without actually lying, this is what they do. Like if they have someone stock dragging down their account, they just sell it, and it's gone from the account. And now you'd say, look what I'm doing for my investors. I mean, you can add you can put 10x these numbers, everything 10x, so it'd still be the same. Everything would be the same. The percentage would be the same. And you say, look how good I am of an investor. I have a 225% gain for my investors. It's just survivorship bias. If you remove all those stocks that didn't do anything and just show the good stuff, that's what indexes are this way too. Because when a company goes bankrupt and falls out of the S&P 500, that information is gone. It's not part of the S&P 500 anymore. Whatever they replace it with will be part of the S&P 500. Of course, if I was an investment firm and somebody said, "Well, I want to see your portfolio for the whole year, not just as of today or the past few years," then we wouldn't cover the Intel. Like I can't say I never owned it. But I could, for purposes of just getting a screenshot at a point in time, you could manipulate things. This is one strategy. And it's like that with a lot of things. Like if you own businesses like franchises, right? Say you invest in McDonald's franchises. And somebody's looking at your portfolio today. They don't see the companies that went bankrupt. If you just look at your today's portfolio, you just see the stores that are currently active today. So some may be overperforming, some underperforming. But it's just something to consider. And some people this may be common sense to some people, but some people don't think about these things. But I'm the same. I'm not going to lie to you. Like I'll show you my portfolio. I have two portfolios, and survivorship bias is part of it. Like there's some stocks that I sold that aren't in my portfolio anymore, so it makes me look better. Also, it could do the opposite. Survivorship bias. You might have a stock, say for instance, this has happened. Let me compare 620s and let's just say on, well, 630 didn't happen, but let's just pretend 630 happens. And my best performer was Tesla, up 450%. And let's just say I wanted to take in my gains for Tesla. And I have 55,000 in Tesla. So I wanted to just keep adding to my QQQ. So I buy another 55,000 of QQQ. Name. Can't remember somebody's name. Yeah, let's say I sold out my Tesla. QQQ. So it was 225% my gain, and now it's down. But I guess that's irrelevant. I just thought that's interesting. Okay, Oscar. So I did a video on Oscar. Let me here's my Excel file. Okay. So it seems really undervalued. I mean, I did a 12% whack. That's a discount rate. So the higher the whack, the lower the valuation. So say I did a normal whack, like 8%. Like here's the stock price. How sensitive these models are. That's why only like maybe 10% of my investing decision is these DCF models, because so Oscar, here are their financials the past few years. So pretty good numbers, right? Free cash flow 350 million in 2022, but it was negative in 2023. And you can see their revenue went up 42%, but their revenue really grew a lot from 2023 to 2024. It's over 9 billion, and their free cash flow is nearly 1 billion. And then their free cash flow goes up to 1.2 billion in the trailing 12 months. And they positive net income. It was negative in 22 and 23. Now it's positive. So pretty good numbers. Historically, the stock has not done well. So since they started trading back in 2021, a few months after, 1 year after the COVID peak, March 2021. So it's down 41% since it started trading. It's 21 now. It looks like it was 21 when it started trading. but it says it's down 41%. So maybe it goes back a little further. The past 5 years, it's same thing. It's up the past year. Year to date, it's up a lot, 58%. Just in the past week alone, it's nearly up. It's up almost 50%. In one day, you can't really see. So in the past week, it's up nearly 50%. So why is it up so much? I think the government has a lot to do with it. Oscar Health. The government it's boring. Let's see if so. Up 50% over the past 5 days. It doesn't really give you much information. Okay, here they talk about it. It's under the bill, lawmakers are looking to establish a Part E of self-funded Medicare plan to be offered alongside private insurance across all states and federal marketplaces. So a lot of it is this this new Medicare benefit. While this would heighten competition with private insurers such as Oscar Health, the voluntary enrollment could potentially delay or prevent Medicare's insolvency. So Medicare is struggling, which most governmental agencies are struggling. Is a lot of bureaucracy, a lot of inefficiencies. It's just a lot of wasted money. I mean, we spend more money than anybody else, more money than any government, trillions. A close-up of a patient and healthcare professional engaging in conversation showing the company's commitment to patient care. Fear is brewed over Medicare getting insolvent sooner than expected, with the cautious sentiment spilling over to stocks as Oscar Health. So stocks like this are going to benefit from Medicare and Medicaid going out of business. While we acknowledge the potential of Oscar as an investment, our conviction lies in the belief that some AI stocks hold greater promise for delivering high returns and have limited downside risk. Okay, so that's kind of like the liability clause. Oscar Health. It's a new company. It's founded just in 2012. Josh Kushner, who has a private equity firm also in New York City. So it's a new wave of healthcare companies. It's telemedicine, so you can talk to your doctor online instead of going into the office. So it's using more technology, AI, things like that, and has transparent claims pricing systems, because it's confusing. It's not straightforward. The Medicare industry, it's very inefficient, and a lot of people sometimes don't even know what they're paying for, or what how much, especially if you have insurance. If you don't have insurance, you know what you're paying for because you're paying out of pocket. But if you have insurance, you don't even really know what's covered half the time, or what's not covered, or, I mean, they could rip you off. I don't think they are. I don't think it's not like a auto mechanic. Like, some of them are actively ripping you off, but I don't think they're doing that at probably medical companies, because people who work at medical companies are just employees generally. But I think there's a lot of times people make errors and it's at your cost, and I don't think people even realize that error, or you wouldn't even know how to like identify it. But according to the company, it was founded in 2012. Blah blah. Okay, so Harvard classmates. Um, Oscar began selling insurance for 2013, the same year that the Affordable Care Act exchanges an individual mandate went into effect. In its first year, Oscar secured 16,000 members. It expanded to New Jersey and grew to 40,000 members. I wonder who the top health, top medical providers. Does anybody have Oscar as a medical provider? I've never heard. Maybe California doesn't. That's probably why I never heard of it. Um, top private medical providers. I wonder if they even top 50. United Health is the biggest. Elevance, that was Anthem. So I'm familiar with Anthem. Humana, I'm familiar with. CVS, I'm definitely familiar with. Kaiser, I have Kaiser. Kaiser's the best. Um, Blue Cross Blue Shield. Oh, they have it broken down by state, by Michigan, New Jersey. Health Net. A lot of Blue Cross by states. Oscar. So I think it's the same as a Kaiser. It's the same type of company, but they just do telehealth. Where's uh, where's Oscar? Oscar Health ranking. The best health insurance company should have excellent. Oscar takes the top spot as the best overall health insurance company. But I wonder where it ranks. I'm just curious, especially if you're investing. Like, where would it fall in terms of members? Maybe I should ask ChatGPT. ChatGPT. Okay. Where does Oscar Health rank in terms of members? I bet you I'm not going to get a good answer. Oscar had 2 million members, up from 1.4 million. So it did tell me. I was curious the ranking. It did tell me the number of members, which I guess is good, but I don't know. Um, Oscar Health. Oscar Health turns annual profits as Obamacare. So 2 million members. Okay, so we have okay, health healthcare members. So it's 2 million. Well, if we see the top 20, let's see this top 25. Does it give you members? No. Best health insurance companies. Okay, healthcare member members. Healthcare members by provider. I guess it's just hard to find. Okay. Okay. What healthcare company has the most members? Okay. So this says only United Health enrollment is 4.8 million. Oscar's 2 million. So I thought that it'd be a lot wider, the gap. Elevance is 5 million. Kaiser's almost 9 million. Centene is 5 million. Humana is 400,000. Maybe I think they're defining members differently. I think the Oscar members are just people who don't pay for a premium, monthly premium. Maybe they get some type of service. Well, maybe they do pay a monthly premium. Yeah, so telehealth is probably the future of medicine. You will always need to go to the doctor, but I think less and less over time, especially if you're sick. And remember when you were growing up, I don't know how old you are, but going to the doctor, physically going there, and then you could get other people sick. But unless it's something the doctor really needs to physically touch or see in person, it's probably better if you don't leave the house. So they're growing a lot. They're the latest quarter, 1Q, 3 billion of revenue. And most of that is premiums. It's pretty much all premiums. And it's up 50%, almost 50% from first quarter of 2024. I want to get a little more detail if they provide it. A premium. Okay. Premium revenue includes direct policy premiums collected from members and the federal government because it's subsidized, especially if you're over 65. assumed policy premiums received as part of the reinsurance arrangement under the Cigna Plus Oscar small group plan offering. So it's mostly premiums they receive directly from people like me and you, patients, and also the government for Medicare, Medicaid. I'd be interested if they give a breakdown of how much they receive from the government. The direct policy premiums received from Centers for Medicare and Medicaid Services. Was 3 billion. They have to adjust it for. I know what assumed premiums are. That's when you assume the reinsurance policy from another. That's called reinsurance. Risk adjusted transfers. I think that may also be part of reinsurance. No, because reinsurance is down here. Risk adjusted adjustment transfers. I'm not exactly sure how to define that. But anyways, so the direct premiums they received was 3.3 billion just for the first quarter, and most of that 3.1 billion is from Medicare and Medicaid. So a majority of their premiums is from those services. So that's why the stock moved up so much. Because a Kaiser probably wouldn't be as dependent on Medicare and Medicaid. A lot of companies have Kaiser that they offer to their employees. Do companies offer Oscar Health? I would imagine Oscar Insurance. Oscar offers health insurance plans. Yeah, I mean they do say it on their website. Yeah, I remember seeing this. It's all Oscar health insurance plans are for individuals. So if I needed insurance, or for me personally, or if I had a family and I want to get insurance, I can call them or email them and buy insurance directly from Oscar. It's expensive if you don't go through a company or you don't go through a larger entity, but some people have to, especially if you're a small business owner. So individuals, families, and also your employer. They don't say the government. I wonder why they don't mention that at all, but I'm sure it's talked about somewhere. Health insurance that works as hard as your employees. Small business health insurance. Okay, so here it is. So the 4,000 companies go through Oscar. It's not in every state. So in California, I don't think they are. Let me pick a zip code in California. They didn't say. I was expecting them to come back and say we don't cover. You have to go through their website and give them information, and I'll contact you. I imagine they would just say we don't cover California. What states does Oscar operate in? 18 states. So you have to live in pretty much these 18 states: Arizona, Florida, Georgia, Illinois, Kansas, Michigan, Missouri, North Carolina, Nebraska, New Jersey, New York, Ohio, Oklahoma, Pennsylvania, Tennessee. So California is not there. So more than half the states are not, they don't cover more than half the states. But that's fine, I mean, eventually they will cover more, or there's plenty of people in these states to run a business. Let me know if there's other tickers. It's good to see what they say. I'm curious what they say about Medicare and Medicaid. The Centers for Medicare and Medicaid Services is focused on improving integrity in the healthcare marketplace and enrollment process, and we expect, because Medicare and Medicaid is not like a company that provides medical services. Oscar is a company that provides medical services, and Oscar gets funded through Medicare and Medicaid. And the way Medicare and Medicaid gets funded is from your paycheck. So, not from my paycheck, because they don't work in California, but Medicare and Medicaid funds, if you're in if you have Kaiser and you're 75 years old, you probably pay. I know my mother-in-law has Kaiser, and I think it's like $100 a month. So $100, she spends $100 a month, and then maybe her insurance is maybe $1,000 a month. Must be a lot, because when you're that old, could be $2,000 a month. So Medicare pays Kaiser $2,000 a month, $100 from my mother-in-law, and they $1,900 from their pocket. And how did the money get in their pocket? From my paycheck and all the other people's paychecks, because we fund Medicare and Medicaid, which it's not going to go to business. I know people. That's something that's part of due diligence. Like, is Medicare, Medicaid going away? I mean, it may lessen. It may not be as beneficial as it was in the past, but we can't leave senior citizens in the dust, and with no way to cover the medical expenses, because then there'll be a lot of homeless seniors, because that's probably their main expense is medical, if they didn't have insurance. Even with insurance, some seniors pay several $100s a month, or even sometimes thousands a month, in just the for their medication, even if it's covered. Some it's expensive, and some people have 10 different medications they're on, and if it's $50 each, it adds up. How much longer will Medicare and Medicaid be around? Last year's report said the go broke date for Medicare's hospital insurance trust fund is 2036. So that's what, 11 years. So I won't benefit from it. I paid a lot of money for it. But the latest report pushed that date to 2033. Medicare is a federal health insurance program that offers coverage for people 65 and older, as well as people with certain disabilities. So it's not just seniors, it's people with disabilities. So if you're born with a disability, you physically can't do things. You can't, if you can't walk, or you're in a chronic pain, the government helps you out. So the government pays for your Medicare medical expenses through these programs. You also get Social Security benefits. So it's what percent, uh, what ages receive Medicare? I'd probably say 95% of people who receive Medicare, Medicaid are over 65 years old. But there's plenty of people who are younger, even kids. Um, they have Medicare Part A, B, C, and D. So A is hospital insurance, B is Medicare, C is Medicare Advantage, and D is drug coverage. Okay, so A, most people don't pay a premium for Part A. This is called premium free Part A. You won't pay Part A premium if you qualify to get retirement or disability benefits from Social Security. Are 65 or older. Part B. So you don't need all parts. I wonder if it's required. I think it's required. I think you automatically get this insurance. But if you want like other, like Part B, for instance, you'll pay a premium for Part B covered every month, even if you don't get Part B covered services. So the monthly premium can change each year. Part C. So I think some of these are optional. Part D monthly premiums, Part D coverage varies based on which plan you join. Isn't America great that they give you this? I mean, a lot of countries, you get free medical for whatever age you are. Okay, let's just one. So in 1940, I have a feeling they're not going to give us. Okay, how much is Medicare insurance cost? I have a feeling if we go through those questionnaire, they're not going to give us the answer. They're going to ask us to provide an email, and then they're going to contact us. Okay. So Medicare Part A, you don't pay anything. Like we saw earlier, it's free Part A. So you automatically get. There's a deductible, so you do have to pay the first $1,676, and then after that, you don't. Then it's pretty much free in a sense. After you pay Part A deductible. Okay, so Part B is the one you pay. There's so many things going on. So Part B is $185 per month. I think it depends on a lot of things, but that's probably the average, which is really, really cheap. If you live in America, that's really cheap. I mean, if you're 20 years old, or maybe 25 if you start working. Victor, what's up? Cool stream earlier. Yeah, if you start working and you're in your early to mid 20s and you offer your parents insurance, it might be pretty low. If you get the no frills, it could be as low as $200-300 a month. But if you're like 40, 50, and you get a good insurance, it could easily be $1,000 a month per person, sometimes more. So 185 a month, and this is for people who are 65 and older. Like even I'm on like the Kaiser plan, which is kind of like the basic plan. So if I had like Like, say I had a 15-year-old, which I don't, and I'm on the basic Kaiser plan. So I know how much mine cost a month. I'm in my 40s. So I'm like, I have the highest deductible, so it's the cheapest monthly premium. So I think it's like $400 a month. But if I had a 15-year-old, it'll probably be pretty cheap for him. Probably like 150 a month. But what if I was 60 years old? Even with the basic plan, it'd still be like 900 a month or something, or maybe even like more. I think 1100 a month. Probably a teenager is the cheapest. Uh, I would think if you have like a newborn, a 1, 2, 3 year old, I don't think I think it's probably more expensive, the monthly premium, than if you had like a 12-year-old. Because when you're young, especially if you're like in your teens or early 20s, you're healthy, you're strong, you have a good immune system. But once you start getting up there in age, and they used to in like 2010, or maybe even 20, yeah, around 2010 and before, they looked at your history if you have pre-existing conditions. So say you were 40, you can end up paying like 2,000 a month, and you could be 50 and pay like 1,000 a month, because they would look at your pre-existing history. If you had like autoimmune disease like arthritis, or something that's just with you for the rest of your life, and they know you're going to cost them a lot of money, or they might not even insure you, which is illegal now. They can't do that anymore. They used to do that, but now they just ask you, in order to calculate the premium, they just say, well, you pick the plan, obviously, but after you pick the plan, it's just, I think the only questions are you male, female, and date of birth. And obviously they know your city state, because that does, I think that does influence the prices a little bit. Car insurance definitely influences prices, because I remember I grew up in Staten Island, and I remember somebody telling me, if you're a male in your 20s and you live in Brooklyn, that's the highest insurance, car insurance, because there's much more accidents. Because I remember when I was in Staten Island, and it was like $1,800 a year for car insurance. And then when I was in Buffalo, when I went away to college in Buffalo, it was like 700, and I couldn't believe it, how much cheaper it was, because Buffalo, there's just less accidents. So um insurance. And I was a guy. I remember this girl I was dating, she went to college in Binghamton, and she said it was $200 for her. Um, so that's interesting. Where's that? What? So 185, which is extremely cheap, because most people who are getting this are really old, so they're going to be spending a lot of money, or they have a disability where they can't work. And it's a pretty low deductible, also $257, because they're going to blow through that deductible. And there's all these things, which I don't want to get into. Then you have Part C. Then you have Part D. I wonder if you're like 80 years old. I guess it doesn't even make sense to get private insurance. You just go with the Medicare, Medicaid, because you're going with the same. Like, if you wanted United Healthcare, there's no reason to get United Healthcare if you're 70. Just go to get it through Medicare. It's the same thing. I know if you live in the UK, for example, I was told, like, if you live in the UK, and they have universal health insurance. So it's free. But a lot of people told me that, if you have like something that's pretty serious, you you can wait like a long time to get help. Since it's free, you get what you pay for. Um, like even if you have a basic cold, this is what someone told me. They're from Italy, I think. They said that a lot of times you would heal before you got the appointment. Like if you had a cold or a flu and you wanted help from a doctor, but maybe that was just their experience. Um, but if it was something like really specialized, like they said, you could wait a long time. But they said a lot of people have private insurance in addition, so they'll pay like $200 a month on top of their free insurance. So they get special treatment. They can go to the front of the line, so to speak. So so how does it really benefit Oscar then if Medicare, Medicaid go out of business? Because if they go to business, then that's where 90% of their funding comes from, Medicare and Medicaid. Maybe the stock went up because it wasn't going out of business. I don't know. Let's go to Simply Wall Street because they have articles. So maybe they have articles explaining investor sentiment improves as stock rises. Investor sentiment deteriorates as stock falls. New amount of risk, share stability. So I don't know if they're really giving you much information. Okay. Move over Hims and Hers. Why Oscar Health went up on Tuesday. Right. If they say they're saying Medicare and Medicaid can only last another decade. The only way to keep it going is taxes would have to go up. But it's so inefficient because these companies, there are people who do illegal things who are stealing millions from these companies. I'm not even talking about that, but they're run so inefficiently, and their people are paid so highly for doing you might have like 20 people doing something where it could be 2 people doing it, but they just have 20 because that's just how it is. And they're paid like, a couple $100,000 each instead of having 2 people paid 100,000 each. So that's just how the government is. And big companies are like that too. As you get bigger and bigger, you get more and more inefficient. Generally, some companies can do it well, grow, keeping efficiencies in place. But as you get bigger, it gets harder and harder. Just think about having one person run a whole company by themselves, a small business. I'm assuming that person is going to do it efficiently. They're obviously not paying anybody because they're doing it by themselves, and they're able to set things up, even if they're not great at automation, if they're doing it by themselves. But then if you have one person and you hire one person, it's easy to look over that person or at least see what they're doing. But once you have hundreds of people, you can't look over every single person. And especially if somebody's running a department who doesn't know what they're doing, which is pretty common. You bought it months ago. Yeah, that was a good buy. Oscar. I think Oscar could be the next multi-bagger in healthcare stocks. Curious. Read on. When it comes to assessing patient care, consumers have a couple of options. On one hand, they can take time to go to brick and mortar retailers like CVS to fulfill a prescription, which is what I usually do. Like I go to my doctor and they write a prescription and they send it into CVS to schedule an appointment and wait in a busy doctor's office. Alternatively, they can streamline their efforts by using Hims and Hers telemedicine services to gain back some time. Right. Oscar Health is a telemedicine, so you can just talk to your doctor online. This technology first approach has served Hims well, particularly as it relates to reacquiring customers across younger demographics and millennials. But I want to know why Oscar's going up so much. I mean, Hims is not going up as much as Oscar is. I don't think so. Hims, wow, it's up 166% year to date. So maybe it is. It's up 12% in the past week. Well, it's at 64. I remember doing a video when it was in the teens. It's really done well. I guess it's telemedicine. I guess that's the future. The company hopes to capture a strategic lead over competitors with a tech-first digital platform. While some legacy insurers have also invested in technology infrastructure, they did so by retrofitting archaic and antiquated manual processes into a technology platform that likely does not fit well with their original business models. They're very old school. The medical industry is very old school. So they did try to make it more advanced, but like this is saying, they're taking that old infrastructure and trying to fit into a technology platform, which usually doesn't work out that well. It may, but it's much better when you build it from scratch, like Oscar is. Another important item to note is that Hims and Hers does not offer as comprehensive service as going to a traditional doctor. Well, Hims and Hers is very focused on a few things. You wouldn't use Hims and Hers if you have a cold. Oscar has a niche focus on affordable health, on Affordable Care Act. While Oscar's upside might appear limited given its niche focus, a look at its metrics suggests it has some strong growth prospects. Despite an intense competitive landscape, Oscar has identified pockets that it can dominate. So did we miss the boat with Oscar and Hims? That's generally what happens. We find out about these stocks after they go up a lot or down a lot. But if they go down a lot, we usually don't buy it. But if they go up a lot of people buy it. The biggest risk surrounding Oscar right now has to do with potential changes in regulatory landscape. So the Affordable Care Act, that will affect this stock a lot. While policy changes could put some pressure on Oscar's core business, the company is working to diversify its revenue stream by expanding into related markets. Data that Oscar Health recently provided to investors shows that its primary market of traditional ACA members totals 21 million. I thought they only had 2 million members. However, by expanding into individual coverage, health reimbursement arrangements, Oscar could open up its total customer pool to 75 million. Maybe they have 21 million patients, but maybe 2 million members. Maybe a company is a member, and within that company, there could be 200 employees using Oscar. Maybe that's what they mean. Oscar could open its total customer pool to 75 million, although I don't think that's likely because there's only 400 million people in the United States. So Oscar doesn't have the 21 million. Maybe they do. Is Oscar Health good buy? It seems undervalued. I mean, it's still down from when it first IPO'd. Oscar's market cap is $4 billion. Is it? I don't know when this article was written. Yeah, it's 4.1 billion. I suspect the market may be pricing a potential for significant downside. So, something to do, consider Netflix. Um, something for learn about the Affordable Care Act. Like, what is it? What's what is how does it affect companies like this? And even if I mean, I read up on this stuff, and I have a hard time connecting it to a stock. Like, I understand Affordable Care Act highly influences Oscar Health, but to connect it and say, oh, okay, if this happens, and Oscar will, it's hard to really understand. There's so many things, but that could just take time after reading it a few times, the same article, or different points of view. Like what I've explained. That's what I usually do for a lot of things, even things I know. Unless it's a stock, I know what a stock is. I don't need that explained to me. But if I'm learning about something, even if something I kind of know what it is, I just want to explain in really basic terms, just so I understand. So I don't miss a simple thing, and then start reading more complex things. It's pretty new. 2010. I didn't realize it was so new. That increases health insurance coverage for the uninsured and implements reforms to the Health Insurance Act. So I did know it was to help the uninsured, but I didn't really know exactly how it boosts the health insurance market. I guess by subsidizing the uninsured. So I guess the Affordable Care Act was Obamacare. I guess that was the Affordable Care Act. Okay. Some pros of Obamacare include more affordable health insurance and coverage for pre-existing health conditions, while some cons include people having to pay higher premiums. Well, someone's got to pay for it, right? The taxpayers are obviously going to pay for it. I think it's good that we pay for things, because I don't think the government does a great job at making things affordable. I think they're very inefficient, and there's too much. There's too many problems, too many crooked people. I think when you let people run a business, a for-profit business, those are the best businesses, because even though Microsoft, Apple, even though uh, they're so big and have so much influence, their goal is to provide the best product or service, because that's how they got to that stage. And the government usually, they don't. A lot of times not even that great of a product or service, and it's so overpriced. I'm talking about taxpayers. We're spending a ton of money, and the government is offering it for free or discounted. So the Affordable Care Act staying. It's like a step below universal health care. Universal health care, where everybody gets free insurance. Affordable Care Act is only the people who can't get free insurance because either they don't work, or or they do work and the jobs they have don't offer it, or the jobs that offer it don't have are really bad insurance policies. I think most of the time it's for people who don't work, or either people don't work or can't find jobs that offer medical, because a lot of people can only find part-time gigs or maybe um, minimum wage jobs, things like that. But even minimum wage jobs offer medical if you're full time. Um, Together with amendments made by it represents the U.S. healthcare system's most significant regulatory overhaul. It's expensive. I mean, it's a lot of money. A lot of tax dollars go into the ACA. Because if you're under 65, you have to pay for your own insurance. Then you have to subsidize other people's insurance, which doesn't seem right, but that's just how it is. With ACA subsidies to expire in 2025. Yeah. So what else is Oscar? Is it a good value? It seems like it, right? They're profitable now. They're pretty healthy. 10 About a 10% net income margin, a little less than 10%. They've been adding shares. They had 230 million, now they have 250 million. So shares are going up. But that's not bad since the EPS went up. As long as the EPS goes up, I'm okay with shares going up. I think they have a pretty good balance sheet. They do an accumulated deficit, so historically they're losing money as a company, but they just recently broke even, like last year, in terms of net income. They've been free cash flow positive for a few years. They do a lot of cash flow, 900 million. That's just for the quarter. So they're going to pay a dividend soon. I think if your healthcare stocks generally pay dividends. United Health. How come I don't see it? United Health. Wait. Healthcare ticker. Oh, it's one word. United Health. That stock's down a lot. I'm sure they pay a nice dividend, 3%, which is, I thought it'd be higher, but they must have cut their dividend. I mean, it's in 5 years, it's pretty much flat, up 4% in 5 years. I mean, if you owned it in 1980s, you're up a lot. But yeah, it's gotten crushed. In the past year, it's down 38%. Year to date, it's down 40%. But it's one of those old, archaic companies that doesn't seem to be able to compete with the telemedicine companies that are much more efficient. But they still have the most members. So this could be a better value. But this stock is not going to be going up 200-300% like HIMSS has. It's also, well, it has gone down. I was about to say it's not going to go down 30-40%, but it has gone down 30-40%. And they have good free cash flow. Look, about 20 billion, almost 25 billion in trailing 12 months. I think it'd be a good buy. But I thought same thing with Intel, and I got burned on that one. Oscar, lots of cash flow. They're investing a lot into the future. They're not really diluting, at least in the first quarter. Looks pretty good. Buffett, if he bought this, I'd feel better about it. Because he's an insurance company. That's his main thing, is insurance. Actually, the guy who runs the insurance, he's insurance. He's staying, and he's Ajit Jain. So he's gonna be continuing on. He's not. He's an older guy. But he's not like Buffett old. He's in his 70s. So I know you have Greg Abel, but the insurance arm is bigger than any other part of Berkshire. So I feel good Ajit is staying. He must have a ton of money. He's an Indian American. So as of 2018, so he's only been there 7 years. Did he work in another capacity at Berkshire? Michael Burr had left Kinsey to join Berkshire in '82. At the time, he said he knew a little about insurance business. So he's been there 7 years, so not that long. I thought he was there longer, but he's done a really good job. Okay, so in the '80s he did work. He did work for Buffett in '86. He left McKinsey, so what is that? Almost 40 years to work on insurance for Buffett. Now he's running the insurance business. Jain was invited by his former boss, Michael Goldberg. So Michael Goldberg worked at Berkshire before Jain, and he admitted he knew little about insurance, but he'd been doing it 40 years, so I'm sure he knows a lot by now. Mike, what's up? So looks good. Looks it's hard because when you invest in these like stocks that are up a lot, it seems like you lose money, right? But if you invest in stocks that are struggling, you still lose money. I guess you got to just hold longer. You can't sell before but yeah, okay. So just want to do a stream. I guess I'll sign out now. Thanks for joining, and maybe I'll do one tomorrow. I'm not sure. Some are comparing Oscar to when Robinhood was 15 and Palantir was at 10. Yeah, people do that a lot, and it's so hard to like. Sometimes they're right, sometimes they're not. Yeah, who knows? Seems good. Seems like a good stock. Okay, talk to you later. Thanks.